A good Wednesday evening to you. We're going to begin tonight with the mental health of our first responders. It is increasingly becoming a priority for public agencies, and that's why today therapists gathered at Arkansas State Police Headquarters for training on a specific type of trauma therapy. Channel 7's Emma Allen joins us now with the details on that. Emma?
Chris, this type of trauma therapy is called eye movement desensitization reprocessing. It stands out because first responders or anyone who uses EMDR doesn't even have to talk about what they're struggling with. They can be done by just simply looking at the eye.
How's this speed? A little slower. A little slower.
20 therapists gathered at Arkansas State Police Headquarters to be trained in the trauma therapy known as eye movement desensitization and reprocessing. This training session was specifically designed for first responders. Lizzie Wiggins is the CEO and head trainer for EMDR Restorative Consulting. She says first responders are exposed to trauma daily, whether it's a shooting, a domestic violence call, or a traumatic incident. Wiggins says emotions can take a toll.
A lot of times they're able to just kind of tough through and carry about things in a regular manner afterwards, but sometimes things strike a nerve in the nervous system.
Wiggins says this can ultimately lead to nightmares, flashbacks, anxiety, or depression, and that's where the special trauma therapy comes in.
So we use eye movements, bilateral eye movements in EMDR to help the brain and nervous system process stuff instead of just having us talk about it.
Wiggins says this kind of therapy replicates rapid eye movement sleep, which is when our eyes automatically move left to right and allows the brain to process material from the day.
But if something overwhelming happens, it's not stored the same way. It stays in panic. And so we replicate REM with a specific event, and that allows us to store it in the past. We know it's not still happening. We don't have to have these big responses and emotional distress to it anymore.
Although some people might be hesitant to trying EMDR, Wiggins fully believes in it, and she says she's seen firsthand how it's helped her clients.
In reality, it's very evidence-based and highly effective and more quick and kinder to the client because they don't have to talk about the whole event. We just select key elements of the memory to focus on, so it's much less re-traumatizing than potentially other trauma modalities.
The funding for this trauma therapy comes from NAMI Arkansas, a nonprofit organization that focuses on helping people living with mental illness. On your side, I'm Emma Allen.
Hey, fascinating, Emma. Thanks very much. Troopers will have access to 12 free trauma therapy sessions from those therapists whenever they're needed.